Hello, everyone. A warm welcome to everyone to this webinar. I hope you're all doing well and keeping safe. I know summer is approaching and everyone's excited to do some activities, enjoy the warm weather, get some exercise. But what's important is to keep healthy and safe. This webinar is going to talk about the COVID-19 vaccine. And before we start, I want to recognize the unceded territories across Canada. Individuals on this webinar are going to be participating from all across the country. And it's really important that we recognize the land on which we sit, unceded land territory. And it's important to recognize that within ourselves as settlers of this land and to work as an ally among the Indigenous people to help protect the environment, the land, the water, and the animals that live here. So now I'm very excited to introduce Megan Richards. She's an accessibility specialist and she's here along with her team. So I'll turn it over now to Megan and let her introduce the rest of her team and continue on with her presentation about the COVID-19 vaccine. So I hope you enjoy this webinar.
Thank you, Wissam. And thank you for your introduction. I'm joined today by three of my colleagues. Chantal de la Plante is with Ottawa Public Health, normally as a nutritionist, and in the past year has been working on the city's response to COVID-19. Also joining me today is Christine Malone, who is a diversity and inclusion specialist. And we also have Genevieve Richet-Brulé, sorry, who is a nurse with Ottawa Public Health and working at one of our vaccine clinics. So just a quick note that information changes very quickly right now. And so this information was updated on May the 14th. And any updated information can be found on ottawapublichealth.ca/COVID-19. Next, please. Wissam gave a beautiful land acknowledgement. So normally we do that as well. I'd like to begin by honoring the Algonquin Anishinaabe people on whose traditional unceded territory the city of Ottawa is located. I extend this respect to all First Nations, Inuit, and Métis peoples, their elders, their ancestors, and their valuable past and present contributions to this land. Next, please. So an overview of what we're going to talk about. I'm going to start by talking about some resources that we have available through Ottawa Public Health in ASL and LSQ. Going to give a short overview on some of the work that we've done for masks and communication. Chantal will take over and talk about Vaccine 101 and accessibility, and we'll give you a vaccination clinic walkthrough. Chantal has just let me know that this is not actually the latest presentation, Paula. Do you want us to share? We had made some updates probably very recently. So I think you may need to promote Chantel so she can share her screen. Thank you. All right, let's try this again. Thank you, Paula, and thank you, Chantel. So almost the same, slightly different order. To start, resources in ASL and LSQ, masks and communication. We'll talk about making your appointment and getting to our clinics, vaccine safety, side effects, and risks. And then from the Ottawa side, we can talk about clinic accessibility, and we'll give you a walkthrough of one of our clinics. Next, please. All right, resources in ASL and LSQ. So from the very beginning of COVID-19, it was very important for the City of Ottawa and Ottawa Public Health to provide accessible information to the public. Since mid-March 2020, all of our media availabilities and town halls have included ASL and LSQ interpretation. And these events are streamed and saved on the City of Ottawa and Ottawa Public Health YouTube channels. I know that we have people joining us from across the country today, and that's wonderful. But a lot of this information is relevant across the country as well. So I welcome you to check out some of these videos and information that we have shared with the public. Next, please. Thanks. Oh, you skipped one, Chantal.
Sorry, I had skipped one and then I went back to it.
Oh, okay. So our resources in ASL and LSQ, we have many videos that provide accurate, reliable, and up-to-date COVID-19 resources in ASL and LSQ for the deaf and hard of hearing community in Ottawa. We have these on our Ottawa Public Health YouTube channel and the Ottawa Public Health website. And when Paula shares the presentation with you, you'll be able to access these links to our resources in ASL and LSQ. These are all the different videos that we have included. And as I mentioned, these are relevant across the country as well as within the City of Ottawa. It includes hand washing, physical distancing, mandatory masks, self-isolation, shopping etiquette, taking care of your mental health, and how to access the Distress Center of Ottawa using VRS, the flu vaccine, information on how mRNA vaccines work, what are the side effects of COVID-19 vaccines, the difference between vaccines, vaccinations, and immunizations, and lastly, why vaccines are important. So we've been adding this information to our site over the last year. We're certainly open for suggestions on areas that we need to include more information in ASL and LSQ. So I certainly encourage anybody to reach out to us if there are gaps in this information.
Just going to pause.
Yeah.
Change interpreters.
All right. masks and communication. So we wanted to create information for the public with the understanding that some people who are deaf or hard of hearing can rely on lip reading to help understand verbal messages, and masks can certainly create a barrier for many people. So we have a position that workplaces should be adaptable and kind when communicating with a person who is deaf or hard of hearing. And we ask businesses and the public to ask the person their their preferred way of communicating. So it could be sharing information electronically, through text, in writing, through signage, and different methods to ensure that we are still able to communicate in a safe way while wearing our masks. I just covered that. So we can communicate by using written text, using a phone or an app, sharing information through signage, as I said. We've also provided guidelines for situations where someone may require an employee to remove their mask to speak with them. And we would ask that distancing is respected during this time and that we use plexiglass barriers when possible. I'm now going to pass it over to Chantel.
Hi, everyone. Thank you so much, Megan. So this part of the presentation will touch on the vaccine-specific content. So in Ontario, I know people are joining from across Canada today. So recently, as of this week on May 18th in Ontario, everyone who is 18 years and older can now book their vaccine appointment at one of our mass immunization community clinics. And starting the week of May 31st, people who are between the ages of 12 and 17 will also be able to make their appointment for their vaccine at one of the mass immunization community clinics. So this is really great news because it means that vaccines are that much more available and we are one small step closer to getting everyone vaccinated and life returning to some semblance of normal. So if you do live in Ottawa, there are a few different ways to book your appointment. So the first thing is to confirm your eligibility, but like I mentioned, this is now solely based on age. So if you're 18 plus, or if you're actually 17 and turning 18 in 2021, you can go ahead and book right now. And the younger 12 to 17 group is eligible in the coming weeks. So depending on that, then you can go through the different booking options. So first is, like your first line of defense, I would say, is to go through the provincial portal. There are online booking options there, and there are also TTY booking options if you require that phone support to book. So to book online, you need a green and white health card, but if you have a white and red health card, then you can call the TTY number, which we'll share at the end of the presentation. It will be on the slide for you. And you could call that number to book by phone. There is also the option to book via a pharmacy or your primary care physician. And the information on which pharmacies are participating and how to reach them is available via this link here. So these blue underlined words are hyperlinked, and they will take you to the right web page to get the information there. And then there are some opportunities for Ottawa Public Health to also support booking. So in some cases where someone needs a little bit more support, accessibility considerations, you can call Ottawa Public Health. We operate through both TTY and VRS, and you can call over the phone for those supports. In the event that you do not have an OHIP card, so our provincial health card here, if you identify as Indigenous, if you are homeless, or if you cannot use the internet. In addition to this, it's also if someone is a resident of Quebec but works in Ottawa, they can request to make their appointment here in Ottawa through Ottawa Public Health. You may be in a position where you are aware of someone who needs a little bit of support in booking their appointment. And if you are able to help someone book, then that's a great thing to do. And it's quite straightforward. All you need first is to get their verbal consent. You don't need any proof of this. You just need verbal consent. And then following that, it's to get their personal contact information. So you're looking to get things like their health card information, their address, their postal code, their phone number if they have one, their email address if they have one as well, and their birthday, of course. And then you could register them online or by phone using the method of your choice. And then the last step is to make sure you share all of the details, the date, the time, and the location with the person, and to ask them if they need help setting up their transportation to get to the clinic at the same time. And this brings me to the next slide, which is how to get to the clinic. So first, folks are encouraged to make their own transportation plan by reaching out to family, friends, to see if there's an OC Transpo route that will be convenient for them. Or if they're a paratranspo user, they could make that appointment as well. If these options are not available, the city does offer a free transportation service. People are only asked to wear a mask while they're in the vehicle and to follow the COVID protocols that are in place. You can set this up by calling 211, and you'll need to provide your appointment booking number to make that reservation. The volunteers are asking for 48 hours at least to have the notice to schedule people and to be available for you. And then if people are also social assistant recipients in Ottawa, they can contact their caseworker for help with the transportation costs if needed. Hope I'm not talking too quickly. So we'll move on now to booking your second dose. So most people who are, well, all people who are now booking their appointments, and this has been going on for a while now, if you're booking through to go to a community clinic through the provincial portal, you will be given your appointment date for both your first and your second dose at the same time. There are, however, some people who did not get their second dose appointment at the time of booking their first, because that process was not in place in the very early days of the vaccine rollout here locally in Ottawa. So if people are waiting to know about how second dose appointments will work, we're still looking at the process for that. So I encourage you to register for the city newsletter, our COVID-19 newsletter, through this link here. And that is a way to get the most timely information on all things COVID-19 in Ottawa. You can also consult our website at ottawapublichealth.ca/vaccine second dose to see what the latest news is there as well. Now well, this is new today, actually. So this could be updated now, but for second doses for people who received AstraZeneca for their first vaccine. So the AstraZeneca vaccine was paused while the province was made the decision for safety concerns to pause the vaccine. And recently, late last night or this morning, the province announced that people who got their first dose of AstraZeneca will also be receiving AstraZeneca for their second dose. I know that there is concern about the blood clots. It's a real concern to have. From the data that is available, we do see that the risk of having a blood clot from the vaccine in someone's second dose is much, much, much lower than in the first dose. And I know the province was looking at some clinical trial results that were being done in the UK to see if people who got AstraZeneca for their first dose could then get a different vaccine for their second dose. So now we know that that is not the recommended approach. So people will be, people who got AstraZeneca for their first dose will actually be contacted by the pharmacy or their primary care provider that gave them, well, in Ontario anyways, they'll be contacted by the person who gave them their first dose in order to schedule their second dose appointment. Okay, we'll touch a little bit on vaccine safety now. So I understand the concern that some folks are hesitant about the vaccine for a variety of reasons, and it is a very real concern to have. I just want to provide some background information to hopefully clarify things on vaccine safety. So on May 17th, so just a few days ago, the global distribution of COVID-19 vaccines was at 1.5 billion vaccines around the world. So we have a lot of real world data that continues to support the use of COVID-19 vaccines. So this combined with the clinical trial evidence does support vaccines. It shows that the vaccines are very effective at preventing people from getting seriously sick and dying from COVID-19. None of the vaccines are made of a real virus, so none of the vaccines can make you sick with COVID-19. And of course, we can't talk about vaccine safety without also discussing AstraZeneca. So as I mentioned before, the province paused the distribution of first doses. And before this decision was made, the risks of a severe outcome from COVID-19 were much higher than the risk of having a blood clot from the AstraZeneca vaccine. And now the rates of COVID-19 are starting to decrease, and the risk of a blood clot and a severe outcome from the AstraZeneca vaccine actually had increased. So those two indicators prompted the province to pause the distribution of the vaccines. The province and Ottawa Public Health does maintain that with the information that we had at the time, people who chose to get vaccinated with the AstraZeneca vaccine made the right decision to protect themselves, their loved ones, and their community. I would just like to add a little bit of information about how clinical trials work. So clinical trials have 3 phases. In the third and final phase of the clinical trials, there are tens of thousands of volunteers. So 30,000, 40,000 volunteers. And although that is a large scale of people, events such as a blood clot that are very rare may not be captured in the clinical trial just by virtue of the number of people who are participating in it. So when these vaccines are distributed globally, and they're accessible to hundreds of thousands of people or millions of people, then those extremely rare side effects and risks do become apparent, like they did in the case of the AstraZeneca vaccine.
If we could just have a moment, please, to switch.
All right, so we'll touch a little bit on the variants of concern and vaccine effectiveness towards the variants of concern. So from the evidence that we have now, the current vaccines that are being distributed are at least partially effective against one or more of the variants. Some information I received yesterday on a different webinar that I was a participant on, I learned that the vaccines that are being distributed are as effective against the UK variant, and they're slightly less effective against the Africa variant. However, effectiveness does increase quite a bit when someone has 2 doses, and protection against symptomatic illness, severe illness, and death is actually very good against the variant still. So it's important to get vaccinated with the vaccines that we have available to us today, even though the variants are becoming more of a concern. And we still need more research to see whether we will need an annual booster or a different vaccine in the future. That's to be determined. Now we'll touch a little bit about getting vaccinated and what that looks like, the reasons why. So why should someone get vaccinated? I think that it's important to protect yourself from becoming severely sick and potentially dying from COVID-19. You know, this is a real thing that does happen to people who are young, who are healthy, who are old, and everyone in between. So really to protect oneself is the best argument. And also to protect the community, because by getting vaccinated, we are reducing the burden on the healthcare system. And we're allowing people who have specialist appointment and surgeries scheduled, we're allowing all of that really health-saving preventative work to resume. What does life after vaccination look like? So for the time being, in the immediate future, people are being asked to continue following public health measures. So we're going to ask everyone to continue masking and distancing and staying with members of their own household, if that's possible, and hand hygiene. It's not for forever, but for the time being, not everyone can get vaccinated at the same time. So while you may be vaccinated, there are still a lot of vulnerable people, and you do still need 2 doses for maximum immunity. So we would like to get to a point where we see less community transmission before we can start lifting those public health measures. But the end is near, hopefully. The Public Health Agency of Canada released some guidelines recently recommending that we achieve 75%, with 70 or 75% of people should be vaccinated with their first dose before we can, and 20% of people should be vaccinated with their second dose before we can start lifting some public health measures this summer. And then to lift measures further, we're going to look at having 75% of people fully vaccinated with their first and their second dose. So the side effects and risks of the vaccine. There are Very common and common side effects. These occur in 1% to more than 10% of people. I know I myself was vaccinated a few weeks ago and I experienced some arm pain. I experienced a little bit of chills that night. It did go away within 1 day. Most other people in my circle who have had their vaccine as well, similar thing, a little bit of a headache, some swelling at the injection site. And these symptoms are very common, so don't be alarmed if they happen to you. They will only last for 24 to 48 hours, 1 to 2 days, and they should go away on their own. Even these uncommon symptoms that happen in under 1% of people, so the yellow category here. These are also normal, nothing to be alarmed about. The only time to be alarmed is when they start impeding on your day-to-day activities. And if they don't go away within 2 days or they get worse within 2 days. And then very rarely, there's a risk of a severe allergic reaction. So this is mitigated by asking people to stay for 15 to 30 minutes after their injection at the clinic to be monitored by a nurse. And then very rarely as well, the risk of a blood clot, and this is with the AstraZeneca and Janssen vaccine. In terms of long-term side effects, this is one piece that, from what I can see, makes people hesitant. I hear some folks say, I'm going to wait and see what the impact is. And from what we know, if a vaccine is going to have adverse effects, they're usually seen within the first 8 weeks. So AstraZeneca being an example of that. These rare side effects were not seen on a smaller scale, but then they were seen on a very large scale. We also know that clinical trial participants are still being followed, and to date, no negative long-term side effects have been seen. Serious adverse reactions to the vaccines are extremely rare, and the Government of Canada continuously monitors the safety of vaccines. The federal government is also implementing a vaccine injury support program for all Health Canada approved vaccines, including the COVID-19 vaccines. So this will ensure that all Canadians have fair access to support in the rare event that they experience an adverse reaction to a vaccine. This is a program that has been in place in Quebec for about the last 30 years. The government is looking at that model to establish a federal program. So I would encourage you all to use the knowledge that you gained today to help build community immunity. So talk about what you learned today with your friends and with your family. Share the resources out with them. Point people to our Ottawa Public Health webpage, our newsletters, and our ASL and LSQ videos. Get evidence-based information. Another thing is when you come across someone who may be a little ambivalent, a little unsure whether or not they're ready for vaccination, don't belittle or shame people for having questions or concerns. Show compassion, show empathy. People usually just want to be heard, and that is a really great place to start because it builds some trust between you and the other person. And when they have concerns, they may feel comfortable coming to you with them. And talking about these concerns is a great first step in getting people to feel comfortable with vaccination. So when someone says that they're not sure about the vaccine, ask them, what makes you hesitant? What makes you unsure? As opposed to, why are you hesitant? Just that simple phrasing can make someone feel comfortable without feeling attacked. And also, if you've had your vaccine yet, congratulations. That's amazing. Share your experience with the people around you. Tell them what it was like at the clinic. Tell them how you felt afterwards. That helps people see that it's an okay thing to do. It's in fact a good thing to do. So I'll now turn over the presentation to Geneviève, who will take you through the vaccination clinic.
All right. Thank you for allowing me to talk about what it's like. So the first slide that you're seeing is when you arrive at the clinic, they will ask you certain questions to make sure that you have no COVID symptoms, that you have not been in contact with anyone that has COVID, and that you haven't traveled outside the country. So if you need the reception staff to remove their masks, you can ask for that because we want to make sure that that you understand the questions, and also they have a written copy that you could look at, and they would point to every question that they want you to answer. A recent experience where we had someone who was having difficulty, he brought an interpreter with him who was able to help him navigate through every section of the clinic. Next slide, please. So this is, it's really just a hall to go back, to go towards the check-in. And what happens at the check-in, could I have the next slide, please? Is again, you'll have, I'm only showing 2 booths, but there's about, depending on how big the clinic is, there could be 10, 12 booths. And so you'll be asked to sit, and again, you can ask the COVAX staff to remove their masks. And what they are gathering is your information. So your name, your date of birth, they're just verifying your address. If you have an OHIP number, great. They can scan it if it's a more recent version. And they will make sure that everything that they need for the next step, which will be getting the vaccine, so that it's all in there and that they have the right person when you move forward. All right, next slide. So you'll find that most clinics will have these arrows to give you the direction we want you to go towards the vaccine area, because we're trying to avoid cross traffic. You know, like we don't want anybody coming in mixing with people who are leaving because they've received their vaccine. So they have an entry point. And then after you've had your vaccine, you've waited your 30 minutes, or 15 or 30, you will be asked to leave by a different way. Next slide, please. So you've arrived at the waiting area, and there's always someone to welcome you. They are all wearing face shields, so they could very easily remove their masks so that you understand what you want them, what they would want you to do. So next slide, please. So this is the waiting area, because even though in Ottawa anyways, the appointments are by, how do you say that? I'm trying to think of the English word. It's by a certain time. So we ask you not to arrive more than 5 minutes before your appointment time. But sometimes, you know, we're anxious and we want to get there. And so if you do, they will place you according to your appointment time. So sometimes you may have arrived before someone else, but they're going to be directed before you because they only came 5 minutes before. And that's okay if you arrive earlier. It just means that you may have to wait a little bit. Next slide, please. So you see two things here. Actually, the table that's, I guess, closest to.
We just pause for a minute, please.
To
Sorry.
you. Am I going too fast?
No, we're just needing to switch.
Okay, I'll wait. Okay, I can go. So the table that's closest where you see a laptop, that's where the PHN, the public health nurse lead, will sit and will make sure that the flow and that the nurses are following protocol so that you feel welcomed and that you have everything that you need in order to be able to serve you better. Next slide, please. So this is sort of a picture of what the nursing station looks like at my clinic. And so there was nobody there when I took the picture, but the nurse would be sitting there and would start by verifying that they have the right person sitting in their chair. If you come as a family of 2, of 3, if you come as a family of 2, we will try and have you sit together. If you come alone but with an interpreter, we want that interpreter to be positioned so that we can best serve you. The nurse will ask you a series of questions to ensure that you have no medical condition that could put you at risk of receiving the vaccine. After that, she will immunize you. She will give you a paper document that talks about, the aftercare after receiving a vaccine. And then she will point you in the right direction to go sit for 15 to 30 minutes, depending on your condition. After that 15 minutes, we're going to the post-vaccination area where you're going to sit comfortably. Well, we hope it's comfortable. And after your 15 minutes, the nurse will always show you how to check out. So if I could go to, yeah, so that's another area with plexiglass. So again, I want you to feel very comfortable at letting people know that you would like them to remove their mask. And they will check you out. They will verify that they have the right, if you have an email, that they have the right emails, because right now that's how we give you a copy of, it will be sent electronically, but a copy that you have been immunized. However, if you don't have an email, you can request a copy of of the vaccine you received right at that time. Before, we would automatically give you one, but now the ministry, I guess, wants to be environmentally friendly, and so you have to request it. So I would say, if you don't have an email address, or you just want a copy of the vaccine that you received, you just have to ask. If you ask, they will make you a copy. Next slide. I don't know if I have another one. I guess go back. I don't think that's my part. So you can't see it. I forgot to take a picture, but to the right of the checkout, there is a ramp where you can exit to the outside of the building. And it's always accessible. Like it's got a ramp so that if you, have a walker, you have a cane, you have a wheelchair, you can easily get out. And often you'll find in that waiting area, there are several staff that are watching out to see how they can assist you after you're ready to leave. Okay, I think that ends my presentation.
Okay, I believe it's back to me now. So a couple notes about accessibility of our vaccine clinics. So at the City of Ottawa, we have our own accessibility design standards that include our legislated requirements under the Accessibility for Ontarians with Disabilities Act, as well as the building code and other pieces of legislation. So site visits have been done at all of our sites to ensure that doors have operators, washrooms are accessible, ramps are installed where needed, accessible parking is available, and in some instances, we've increased the amount of accessible parking spaces. Seating is available for those who can't stand for long periods of time. We also have designated areas for paratranspo drop-off and pickup and indoor waiting areas while waiting for your ride. At the city, we have a scent-free policy, so all of our clinic staff are trained on our scent-free policy, and we certainly do our best to maintain a scent-free environment at all of our clinics. Next, please. If there is support that we can provide, as Genevieve mentioned, please let us know when you arrive. Clients who need assistance are allowed to have a support person to accompany them into the vaccine clinic. We also have standard and bariatric wheelchairs available, and you can request those when you arrive at the clinic or in advance. You will be seated while you wait for your vaccine, and we also have stationary bariatric chairs available at all sites. One of the common things that we're asked for are low sensory or quiet areas, and so all sites have this available as well, and we ask that you let staff know if you require access to this space. In terms of accessibility accommodations or communication supports, these can be available to you at our clinics upon request. If you're getting a vaccine at the City of Ottawa, we actually have an online form to request accessibility accommodations. We ask that you let us know 48 hours in advance of your appointment. However, this isn't always possible. And so we certainly do our best to meet your requests at all times whenever we can. So that's available online, but if you needed assistance in completing the request form, or if you don't have access to the internet, you can call Public Health at 613-691-5505. Sorry, it's 613-691-5505. There are different ways that you can reach out to the City of Ottawa. So 311 if you're within Ottawa. If you wanted to call the city using VRS, you can do so by calling 613-580-8888. 2400. We also have TTY available at 613-580-2401. And we've also included the TTY number for Telehealth Ontario for those wishing to book through the province of Ontario. We've provided you with their 1-866 number as well to reach out to the province through TTY. As of yet, we're unaware that the province is offering VRS support for residents. So that wraps up our presentation, and we're certainly open to taking any questions you have. Here are some ways that you can stay in touch with us at Ottawa Public Health through our website or by registering to receive our vaccine newsletter. We also welcome all accessibility related questions and feedback through our accessibility office email. And we also put out a monthly accessibility spotlight newsletter. So not just things related to COVID, but general accessibility across the city. And you can also find us on Facebook, Twitter, YouTube, and Instagram. So that is the wrap up for our presentation. And I will pass it back to Wissam for questions and answers.
Well, thank you very much, Megan and your team. We feel like we've learned a lot today. And this presentation has been recorded and will be posted on YouTube and social media in general to ensure that the deaf, blind, and hard of hearing community who use sign language across Canada have access to this very valuable information. So now we come to the question and answer portion of our session, and I'm wondering if there's anybody here today who would like to ask a question. You can either do that in sign language, or if you'd like to put it in the chat in written form, then I can convey the question. And now we do have a question from Daryl. I wonder if Daryl Hackett is here today, if we could allow him to pose his question directly in sign language. Great. Hi there, Daryl. Hi there. Yes, nice to see you. And yes, thank you, Wissam. My name is Daryl Hackett, and this is my sign name. In fact, Megan, I have a number of questions. I guess I'll have to be selective. First of all, I would like to thank you and the Ottawa Public Health team and the City of Ottawa, of course, the Accessibility Office, for your best efforts in keeping the vaccination clinics as accessible as possible. So we appreciate that very much. My first question is with regard to, I may have missed it, but I'm wondering if you could, speak about the deaf-blind community. They do require interveners because they use hand-over-hand communication. And so that is essential to individuals. I have not to date, I haven't seen any information regarding that in terms of accessibility from your office. As well, so I'm just wondering if you could respond to that question, Megan.
Absolutely. Nice to see you, Daryl.
Thank you. Likewise, Megan. Very good to see you as well.
So all support persons are welcome at our clinics. including interveners for persons who are deaf-blind. Support persons can either just show up at the clinic with the person that they're supporting, so in this case, an intervener, and they would be welcomed. A person could let us know in advance that they're bringing an intervener with them through filling out our online accommodations form, or a person could request for us to arrange an intervener through that same request form. Either way, they're always welcome to attend with the person receiving their vaccination.
Wonderful. Thank you for that. And now we're just going to switch interpreters, if you wouldn't mind just holding on.
Perfect. So Daryl had the first question. I just wanted to clarify. This applies to the city of Ottawa. Does that also apply to the province of Ontario and the rest of Canada? Can we get some clarification for our deaf viewers across Canada?
Unfortunately, there hasn't been a coordinated response for accessibility across the province or across the country. If you remember back to last March in 2020, everybody was providing ASL and LSQ interpretation for media and communications to the public. I don't see a lot of that anymore, whereas we've continued to provide that because we recognize how important that is. I know that some other municipalities, such as Toronto, and you may have some members in Toronto, have been holding special clinics for people with disabilities. And that's received some positive feedback in the community. Whereas the way that we wanted to approach things is for everybody to be able to access all of our clinics with the support that they need. So there's no specific day or time or location. All of them are the right option to ensure that you have the supports that you need. What I can say on that is that we would be happy to share our knowledge and what we've considered to be good practice, not best, we're still learning, with other municipalities across the country who are looking to improve accessibility for vaccinations as well. So if any of you live in an area that is lacking in terms of accessibility, we would be happy to connect and share some of the things that we've implemented with others as well.
To our viewers, if you're not sure, please go ahead and contact me, and I would be happy to facilitate with Megan in terms of and seeing if that knowledge sharing can happen. So hang on. So your next question, Daryl? About a month ago, I looked at the Ottawa Public Health website, and I was trying to get some information about vaccine appointments and whether or not you had health issues and if I qualified to make an appointment. And so I noticed that I met the same age requirements and health issues. And so then I clicked on the provincial Ontario website that was coordinating the various shots, and I saw that I met all of their indicators and responded online to their questions. And then at the end, it came back that I didn't personally meet the qualifications, but I did for the city of Ottawa. So I decided to call in Ottawa Health, and I spoke to an Ottawa public health nurse. And I indicated my health issues and my concerns and my age. And her response was, yes, you definitely qualify. But with the province and their checklist, it was counterintuitive. And so is there something are there resolutions or things in place to work on that? Because there was definitely a discrepancy between the two.
I can take that question again. First, Daryl, I'm sorry that happened to you. That sounds like an incredibly frustrating thing to go through as someone who is ready and willing to get vaccinated, and you went through the steps just to be told that it actually wasn't available to you at the time. So sorry that that you had to go through that. It sounds like a miscommunication between how the system was working and the information that you were getting through the system, and then the outcome of it. At a provincial level and through the provincial booking system, Ottawa Public Health does not have any influence over how the provincial booking system works. So unfortunately, it sounds like a technological mistake that happened when you tried to book. And I wonder if perhaps it was that there were no vaccines available at the time of your booking. So although you were eligible, there were no appointments available. I wonder if that could have been the case, because I know now if I try to book someone who's eligible today, it will tell me try again later, there's no appointments, but I will have to go through all the steps first of putting in their information. So I hope that you're able to try again if you haven't already. I know right now in Ontario and in Ottawa, there is no vaccine availability at the time, but I hope that by next week we're going to have more appointments open up and that you could give it another go.
We have a question in that, oh, sorry, some feedback, in the question and answer box, if I can go ahead with that. Or does Daryl have?
Please.
Okay.
Oh, hang on, just before you go ahead and answer that question in the Q&A, I would like to sign the question for the deaf community.
I can read it out if you want to.
Okay, that's fine, perfect.
Okay. So this is from Scott, and it says, hello, I have a question regarding the temporary drop-in clinics. I recently got vaccinated there a couple of weeks ago. The drop-in clinic I went to only lasted for 2 days, and I learned about it online from a friend, which I didn't get enough time to request accommodation, such as providing VRI. I had to do lip reading and use the live transcribe app. What's the accessibility policy for the temporary drop-in clinics? So
what's the question? The interpreter, what's the last sentence?
What's the accessibility policy for the temporary drop-in clinics?
Okay, thank you.
So this is one of those instances where we might not always have 48 hours advance notice to provide accommodations. We have been using in-person interpreters rather than VRI for our clinics. And we would certainly welcome a call to let us know, or through our online form, which is being continuously monitored. So we can make sure that an interpreter is available to meet you at the temporary clinic for your appointment. So essentially the same. We want to provide accommodations regardless of when they're asked for, whenever possible. So, and our service provider is very good at meeting our last minute requests.
Great. So I personally have 2 questions. With regards to accessibility. I have one suggestion for deaf Ottawa people and Ontarians and Canadians. When individuals who are deaf and enter your clinic, Genevieve had mentioned that, that they're willing to remove their masks to communicate, point to the paper and the various questions that they're seeking answers for. But I'm wondering about VRI as a solution, video remote interpreting. You can have that readily available with an app and an iPad. And as soon as you encounter an individual who comes in who is deaf or hard of hearing, and they identify as deaf and would like to access an interpreter, you could use that app. And the iPad is there, and they can take that iPad with them as their support network throughout the various stages in the clinic. And so when they arrive to check in and get their vaccination clinic, they can use that accessible feature. And then when they finish, they can return the iPad for the next person. So I think that's a great solution. And what are your thoughts about entertaining that kind of a system?
I personally think that that could be a good idea with Sam, and it's something that we can certainly look into. In the beginning, we were going the route of using in-person interpreters because we weren't sure how the clinics would be set up and if we would have that available technology. But I believe most clinics do have iPads. Genevieve, you probably know this better than I do. Yes. So we could certainly look into that as an option moving forward.
We do have extra iPads. And so I think it would be doable. I'm not the best technology person, but if we had one reserved with a VRI, is that how you call it? I think it would, it's interesting to look into that.
Right, and that ensures the safety and the well-being of the interpreter being there in person, right? And so it's a win-win for everyone to access an interpreter via iPad.
That's a great suggestion. Thank you.
Okay, and then my second question, and this is coming from a medical perspective. I know there are inherent risks with a vaccine, that they're low, very low, for instance, like a blood clot, a hemorrhage, or various other possibilities. And are there any permanent long-term lasting effects from vaccine? I know the percentage is very, 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 very low. I understand that, but I'm wondering about any long-term effects of concern. because in the past, the message has been the vaccines are safe. And now the message isn't quite the same. And now they're putting AstraZeneca on hold for the short term. Does that mean that it hasn't been researched effectively long enough? And what are the implications for an individual 10 years down the road from receiving such a vaccine? Just wondering, how do we ensure the safetyness of vaccines for all? I know that you mentioned that there is no live virus within the vaccine itself. But are there other health concerns?
Thanks for your question, Wissam. I'll answer it the best that I can, acknowledging that I'm not a doctor myself. I work in public health. I have a master's in public health. I'd say I'm a communication professional, and I do have a science background, however. And I've done extensive research on all things COVID. So I'll answer the best that I can from the position that I'm in. So from what you're saying, I understand the concern about the safety. What we've just seen with the AstraZeneca vaccine is unfortunate in terms of the vaccine confidence and the impact that can have on people. For the long-term safety of the vaccine, usually, and I think AstraZeneca is actually a good example of this, is that when vaccines are distributed on such a wide, we'll say global scale in this case, those adverse events and those rare but very serious side effects are seen in the first 8 weeks of the vaccine usually. This has been the case for other vaccines in history. So in terms of the messenger RNA vaccines, Pfizer and Moderna, that are currently being distributed, they have been around, they were in the early days of the vaccine response for this pandemic. The clinical trials for those two wrapped up around, I want to say November of 2020. And clinical trial participants before that had the vaccine for quite some time, for a few months prior to that time. So some time has elapsed. And in terms of the long-term effects in 5 years, 10 years, 15 years, we can't say with certainty whether or not there will be. I think that's, it's a bit of a blind spot, right? And I think it's important to acknowledge that. But we can look at what we know about the COVID-19 virus and about that disease and that illness. And there are serious long-term side effects to getting sick with COVID. So 1 in 4 people who have been infected with the virus have what's called long-haul COVID. So long-haul COVID is where you continue to experience I want to say life-altering almost side effects that continue. So headaches that are persistent, extreme fatigue, dizziness, like these really unfortunate events. So we do know the impact of that. Yeah, and in terms of safety, clinical trial participants continue to be followed. So they're sort of, they've had the vaccine before we've had the vaccine as the general public. And so far, there's no alarming long-term side effects that have come up. Had one more point I wanted to mention. The types of vaccine being a messenger RNA vaccine, it's not a new technology. That type of a vaccine has been around before. So I think we do have a lot of evidence showing that it is a safe, we'll call it a technology, like a safe technology to protect ourselves against the virus. So there's a lot of things to support vaccination, even though I will acknowledge that there is some uncertainty in the long term. from what I can see, the majority of the evidence points to this being a really positive thing to do.
If we could just pause to switch interpreters, please. Thank you. Well, thank you very much for your responses and clarifying our questions. I think that it's safe to say that we're comfortable with those answers. And we know that there may be some other questions. I believe Paula does have a question. And so before we wrap up, we'll just allow Paula to ask her question. Yes, thank you very much. I did have a question. I think someone else has already asked a question that I had, but I'm wondering about the Indigenous community. I believe that I'm just wondering about I'm just going to get some clarification. I'm sorry. The package, I believe that the services to the Indigenous community is different than the general population, the Canadian population. And I'm wondering about timelines as well. And if there are different timelines, why is that the case? If you could elaborate on that, please.
Actually, that's my clinic, the Indigenous clinic. Yes, they have been able to speak with the ministry as far as who we are immunizing. So for them at this time, they are the 16-year-old and up are able to come to the Indigenous clinic and receive whether it's their first dose or second dose. Of course, it's by appointment. And we have been working very closely with the different Indigenous groups who help us ensure that we are giving them the best service. And one thing that I'm very grateful for is I make sure that no one is turned away, whatever their issue might be. So we have been working with them, and we have several clinics, and the communities have asked us to make it only an Indigenous clinic so that they don't feel so they feel that they're getting the proper service, and so far we've had a lot of positive feedback, and any little issues that have occurred, we have tried to fix them. So I'm not sure if that's the question you're asking. Let me know.
Yes, that's perfect. That was exactly what I was looking for. Thank you for clarifying that. We understand clearly that there are two different systems in play, in process right now, so thank you. I do have another question I'd like to ask. Well, actually two that I guess I can combine. I'm wondering, once an individual has both doses, will we have something to indicate that we have had both doses of the vaccine? And if there are individuals who, for some reason, for medical reasons or for allergy reactions to the vaccine possibly, and they cannot be vaccinated, I'm wondering how things will be for them. What will life be like for them because they're not able to be vaccinated? And will they be denied entry to certain places in the public because they haven't been vaccinated? So I'm just wondering what things will be like for them. And what Sam is saying, if anybody would, either we can open that up to any one of you to answer if you'd like.
can share what I am aware of, and then if I miss anything, Genevieve, you're welcome to add, or other people here as well are welcome to add. So there currently are no plans in Canada, nothing official asking people to have what we'll call a vaccine passport. So giving fully vaccinated individuals special privileges. Right now, there's no plan for that. I know some provinces like the Yukon, for example, if you show proof of full vaccination status, you're not required to complete self-isolation upon arrival. So certain provinces may choose their own models. To be seen, I'm sure that something will come out from the federal government on what that will mean. And I will reach a point as well, though, where we will reach herd immunity. And that's where those people who are not able to get vaccinated will also be protected. With the variants of concern being so transmissible, I think that from what I've seen and what I've read, it will take some time for us to achieve herd immunity. And herd immunity is when enough people are protected through vaccination that those who can't be protected themselves with their own vaccine are protected by virtue of the virus not really having enough places to spread. So that's how the people who can't get immunized themselves could be protected in the future. If you can get immunized, however, like please do so, because the number that we need to reach, I've read up to 90% of the population should be fully vaccinated in order to achieve herd immunity. Because this is such a contagious virus that is spread almost silently. It's airborne, and the incubation period, like the period of time that you are contagious but you don't exhibit any symptoms, is quite long. And then there's also just asymptomatic transmission in general, like you may never exhibit symptoms, but you may have been contagious. So I hope that answers your question, Paula. And Genevieve, if you would like to add something, maybe you know more about the federal or provincial plans about a potential vaccine passport that I may not be aware of.
No, I have not as of yet. Like you said, I have not heard additional information than what you've shared.
Well, thank you very much. I think that answers my questions. Thank you. So Wissam is saying, do you have anything further? I don't, but I believe there are two other individuals who have questions.
There was another one in the Q&A box. Wissam, do you want me to go ahead with that question?
Sure.
Okay.
Thank you, Megan. If you would like to, that would be great. Thank you.
So this is another one from Scott. I learned that the second dose, as recommended by the Government of Canada, is about 4 months apart from the first dose. In some other countries like the United States, it's a few weeks apart between first and second doses. I would like to understand the logic behind the current recommendation. Does it improve immunity in that regard? I'll pass that to Chantal and or Genevieve to answer.
Would you like to take a stab at it first, Genevieve? I'm happy to answer as well.
So the National Advisory Committee on Immunization, which are all the experts in regards to immunization, have looked at that and have studied it, and they feel that 4 months is an acceptable time. I know that the product monograph says 21 days for Pfizer and 28 days for Moderna. And the Minister of Health did say that if there is a possibility, they will shorten that interval. But the experts felt that 4 months is acceptable for protection-wise to get your second, to wait for your second dose. Of course, everyone would like to have it exactly as prescribed by the product monograph. But at this time, 3 or 4 months is the interval that the ministry has given us. And so that's what we're following. And I've been a nurse a very long time, and I have worked in immunization a very long time. And I feel that NACI is what we call it. I really have relied on them to give me the best practice for on immunization. Chantal, do you have anything you want to add?
I think that was a great answer, Geneviève. Just to add a little context, that supply is limited. So you alluded to that, and in the scenario that we find ourselves in with limited supply and so many people needing this 2-dose vaccine regimen, we do know that everyone having 1 dose is more beneficial than some people having 2 and others being not protected at all. So we know that after getting the first dose of the vaccine, people are extremely well protected against severe illness, ICU admission, and death. So those are like the really serious impacts of COVID-19 on individuals and on the system. So yeah, everyone will get their chance to get their 2 doses within the recommended interval. If supply increases like exponentially, then that schedule may change, but for the time being, the data does support it.
Well, thank you very much for the information you provided, the answers you've given, and I feel that maybe it's time to wrap up our session, or perhaps there's some burning questions someone has in the audience, and if so, this is the time to ask it before we wrap up. Seeing none, then I would like to again thank you for your participation today, and I'm certain that the deaf community, both in Ottawa and across Canada, will very much enjoy this webinar. I'm certain that it will give them a lot of food for thought, and it certainly has clarified, no doubt, some anxieties, some concerns, and encourages individuals to go ahead and get themselves vaccinated if they have not done so already. So again, thank you very much for your participation, and stay safe, and please go ahead, get yourself vaccinated, make the accessibility request as necessary. And I thank you again for your participation. Thank you to the interpreters, both the ASL interpreters and the LSQ interpreters. Thank you again. Stay safe. Have a wonderful long weekend.
Thank you so much, Wissam, and thank you, Paula, as well, for helping to organize this. It's been our pleasure to participate, and we certainly look forward to continuing the conversation with your group moving forward.